Mary Pollock is a self-employed as a lobbyist and writer and has been the Michigan Now lobbyist for the last 5 years and recently became the Capitol correspondent for Michigan Women's Forum. Mary is going to give us a state update of things going on in the legislature. Mary?
Okay. Well, we're taping this on March 25th and
26th.
26th, that's right.
Saturday.
Yeah. We've got 17 pieces of legislation introduced already since January this year concerning reproductive rights. And before we get into that, though, I want to celebrate a little about what happened in the last session. We had 4 bills out of 13 that were introduced about reproductive health that actually got through the Michigan House, and it was historic.
This was part of the prevention package?
This was part of the Women's Health and Pregnancy Prevention Package. Emergency contraception in the emergency rooms, preventing crisis pregnancy center fraud, sexuality, encouraging sexuality, comprehensive sexuality education, and emergency contraception education. Those 4 bills got through, and according to now Senator Rebecca Warren, it had been well over 10 years since anything had gotten through. So that was when we had a Democratic House, and the bills were never taken up in the Republican-controlled Senate, and of course never reached the governor's desk. But this was a notable achievement, and those bills will probably be reintroduced very soon.
And as I recall, with the emergency contraception ones, there was some bipartisan support.
Yes, there was, and so that's notable.
Yes.
And what it did, it flushed out those who are anti-abortion and anti-contraception. Mm-hmm. And it separated them and put the pro-contraception, pro-prevention people in with the pro-choice people.
Right.
So that was very good. Well, in November we had this cataclysmic tsunami of our own here politically, and all branches of government, not just both houses, House and Senate, but Governor Slot and all the other statewide offices and the judicial branch are now Republican controlled. So what's important to know, I think, about that is that candidate and now Governor Rick Snyder refused to answer any candidate questionnaires, including the questionnaire for Michigan Now. He only appeared in ads or carefully controlled town halls where all the people who went to them were screened, so he really was only in front of 20,000 people live. And he told news sources that he was pro-life, that he opposed abortion except to save the life of the mother, rape, and incest, which set him apart from the other pro-life Republican candidates because they told the Right to Life Michigan and Catholic Conference line of just an exception to save the life of the mother. I don't even think that he realized that he was going outside that framework. But at any rate, we know that, in fact, in practice, in a hospital, a Catholic-controlled hospital, it's really what they're looking for is the death of the fetal heartbeat. They don't really care about the health or life of the mother. It's that fetal heartbeat, and they won't even approve a therapeutic abortion unless that fetal heartbeat is gone. And this is as late last year. This happened in a miscarriage situation in West Michigan. So the new Senate has a supermajority of Republicans, and in fact they have 2/3 majority, which gives them the power to give immediate effect on all bills they pass. It also allows them to have the votes to put something on the ballot. Constitutional amendment would be like a personhood amendment. They could vote and put it on. And now, together with a couple, 3 or 4 of the Democrats, there's now 76% of the Senate is anti-choice or mixed. So they can get anything through the Senate along that line that they want to. In the new House, the Republicans have 63 of 110 House seats, 10 short of that two-thirds supermajority.
Okay.
So they would need help from some Democrats to put something on the ballot, like a personhood amendment. But
now can one chamber just put things on the ballot?
No, it takes two chambers, two-thirds vote of each chamber. In the House, 71% are anti-choice, unknown, or mixed voting records. So almost 40% of the Democratic caucus are anti-choice.
Right. Together
with all but one of the Republicans are anti-choice. There's one Republican that's mixed or unknown to us. So they haven't had a vote on anything yet. So we haven't flushed out these mixed and unknowns.
And that's because the governor has said he wants to focus on
budget
and
economy and all that. And of course, he's put out this very radical income tax, business tax proposal, and he's got big cuts in the budget. Right. And then added to that are the kind of Republicans who got elected who beat the moderate Democrats. They want their pound of flesh out of the unions and out of welfare recipients, and so they are going straight ahead on a fairly anti everything Democratic agenda.
Right, well, and a progressive type agenda. But I want to get back to the ballot really just briefly, because the reason why that can be such a concern is we have had efforts in the past
to
put on the ballot a constitutional amendment that
Absolutely.
would define a fetus as a person.
Right, and so I don't know, we have not, those of us in the Choice Coalition, I don't think we know what Right to Life Michigan or Catholic Conference wants to run.
Right.
Either first or ultimately.
Mm-hmm.
So